Okay, let's start in today's lecture the continuation of thoracic biomechanics, that is by from your functional biomechanics part. What is functional biomechanics of the thoracic rib cage on the chest wall? Ventilation is a mechanical process by which air is inhaled and exhaled through the lungs and the airway. That is what the definition of the ventilation says. When we know in the last video, we have already dealt that there are so many types of diameters which are increasing and decreasing on the basis of your inhalation and exhalation process. Let it be a vertical, let it be a transverse, let it be your AP. So kinematics is nothing but increase and decrease in these diameters only. So kinematics first point is increase in vertical diameter. How the vertical diameter gets extended, increased, first one by your radial expansion of the chest wall, and the second one by your displacement of the abdominal content by diaphragm. That is, your diaphragm contracts downwards, the central tendon pulls itself down in a downward direction, thus extending the vertical diameter of the rib cage. Coming to increase in transverse and AP diameter. Now, this is nothing but transverse is side to side distance from rib cage to the other side of the rib cage, and AP is nothing but the distance between the manubrium sterni and the thoracic spine. So these are the kinematics of functional movement of the chest wall and the rib cage. Coming to analysis of force and loading on the thoracic spine. Compression load on the thoracic spine increases caudally, that is in downward direction, from about 9 percentage of body weight at T1 to 47 percentage of body weight at T12. This ability to sustain the increasing loading demands is achieved through a progressive increase in the vertebral body size. Right from cervical till lumbar, the body size of each vertebrae increases. Thus, the capacity to withhold the amount of force placed on it increases progressively as the increase in the level seen. Because of the body size, increase in the body size, end plate cross sectional area, and bone content, particularly in lower six vertebrae of the thoracic spine. Now, coming to two-dimensional force analysis of thoracic spine. Two-dimensional is nothing but your static and dynamic. Two-dimensional is nothing but your static and dynamic. Dynamic. Respiratory efficiency is attained by both static and dynamic equilibrium. In static is nothing but a posture, a maintained posture. Dynamic is nothing but a movement. So thoracic spine has two movements, flexion and extension. So static equilibrium is seen in two types of posture. Normal kyphotic posture, that is slightly slouched, and superincumbent upright straight posture. Second point, dynamic equilibrium is seen in flexion movement and extension movement. Coming to first one, static equilibrium. Let's see how the position of the spine looks. Look at the diagram under normal thoracic kyphotic posture. That is, normally the spine is slightly hunched. So you can see in the arrow under the heading upright posture, the spine is maintained straight upright. So you can see the straight line beside the diagram. This is how the diagram of normal thoracic kyphotic posture and upright posture looks. Now, when you draw the line of gravity exactly falls, you can see in the diagram the line of gravity in normal thoracic kyphotic posture. If you draw it, it exactly falls anterior to the vertebral body. To few of the vertebral body, it definitely falls anterior, and through some it passes. But in upright posture, it passes all through the body is posterior or in the middle part of the vertebral body. What happens, how the force is distributed in normal thoracic kyphotic posture is the force is getting accumulated anteriorly. Thus, this may produce the anterior compression effect on the anterior aspect of the thoracic vertebrae. Whereas in superincumbent upright posture, The force, the compressive load is distributed between the vertebral bodies and the articular processes. This is very important. Thus, that's why from childhood, everyone tells us that do not slouch, do not bend forward while sitting and writing. Please maintain your backs aligned, back straight, so that the compression load is divided and placed equally both on the vertebral body as well as your articular processes, thus reducing the chances of degeneration of the thoracic vertebrae. This is all about static equilibrium. Coming to dynamic equilibrium, the flexion movement at the thoracic spine. Anterior concavity, inflection moment, anterior concavity of thoracic spine places COG, that is your center of gravity of the head and cervical spine, anterior to the thorax, thus producing flexion movement at the thoracic spine. That's what we saw just now. So this is your, if you slouch more at the thoracic spine instead of keeping your upright posture, you're going to produce the flexion movement at the thoracic spine. That is what is nothing but dynamic equilibrium. Now, equilibrium is nothing but the equal amount of force. Let's check how this force is maintained. This that arrow shows the movement arm of the flexion movement of the thoracic spine. Because of the slouched posture, the COG falls anteriorly. Thus, there is flexion movement produced at the thoracic spine. This is the first point. The METEXT is nothing but movement produced externally. The spine is bending because we are bending the spine, because we are fatigued, we are tired maintaining the spine upright in an erect posture. We tend to slouch it. That is externally produced movement. Externally produced movement producing, that is nothing but your flexion, is equal to WS, that is your weight of the head, shoulder, and arm, into the moment arm, the straight perpendicular line drawn from that particular vertebrae to the LOG, that is your line of gravity. This is nothing but movement of the external movement, momentum of the external movement. Now coming to dynamic equilibrium in extension. As kyphosis increases, that is, as we saw in the first slide, there was kyphotic. As the kyphosis increases, there is definitely increased movement of the flexion. So once the flexion starts increasing, the brain detects that this is abnormal. I will fall if I bend my spine more. So what the brain tells to the back extensor muscle? They have to activate themselves in order to produce the upright posture. Thus, it is told that as kyphosis increases, the external flexion moment and resulting internal external moment increases. That means as your bending of the spine increases further, the external flexion produced due to the anteriorly falling LOG increases. To avoid falling of the human body, the back extensor get activated, thus increasing the moment which is produced internally within the body. This produces reaction force on the vertebral bodies, including the compressive component. Let's look how the formula is written. We know that it is dynamic equilibrium. To avoid falling, to avoid if the brain should detect the movement such that the body should not fall. Hence, MEXT, that is movement produced externally, should be equal to movement produced internally. That is nothing but your equilibrium movement, dynamic equilibrium during extension movement. This was explained in the previous slide that this is nothing but your movement occurring due to external force, whereas this is the range of movement occurring due to internal force, that is produced by your muscles. So dynamic equilibrium in extension, the formula is moment produced by internal force should be equal to moment produced by external force. Coming to The next point, in static, this is an important point. In static equilibrium, external movements produced by the weight of the body segment or external load must be balanced by internal movements produced by muscle and ligament to maintain an upright posture. This was the first video. So I hope you all understood the biomechanics part of the thoracic spine. Let's meet you all in the pathomechanics part. Thank you.